I'd like to say it's a real honour to be asked to speak at BOPA and to get the patient's voice heard. I was a consultant breast surgeon and I was diagnosed with breast cancer in 2015 when I was 40. I had no family history. I just thought I had a cyst. I wasn't expecting it to be a cancer. And my life changed overnight. And I realized, despite spending 20 years training to be an expert in breast cancer, I knew nothing about what it was like to be a patient. And I had every single treatment I prescribed to my patients. And again, I realized how little I knew about chemotherapy and radiotherapy, despite telling my patients what it was going to be like. I didn't realize how hard it was to make a decision about mastectomy, going flat, and reconstruction, because you don't think about what your breasts mean to you until they have cancer and one needs to be removed. And then you can't think logically because that breast has cancer in it. I went back to work for a year and then I had a local regional recurrence on my chest wall in 2018, and that meant more surgery, it meant more radiotherapy, and the side effects of stiffness in the shoulder meant I had to retire as a surgeon, and that was in 2019. And breast cancer has changed my life completely, some ways for the good, some ways for the bad. I've learned that I can still help people in many other ways, and that's by talking about my experiences, by helping patients stand up and get their voice heard, and by encouraging healthcare professionals to understand what it's really like to be a patient and how they can help us. I spend a lot of my life breaking bad news as a consultant surgeon, and until you've been on the other side, until you've sat in a waiting room clenching your husband's hand, paranoid that you're going to hear bad news, until you've actually heard those words, you can't get the impact. And hearing bad news myself changed how both my husband, who's a consultant surgeon, and I practiced the way we give bad news. It made me realize that doctors are very good at telling patients what will happen to them, but we're not so good at telling them how to cope. All the drugs I take, no one tells you about how to cope with the side effects or what you can do to make them better. I got all that information from other patients. And the focus of my talk is really how you can improve the quality of patient care. And as a consultant surgeon, quality for me was two things. It was, am I doing the right thing to the right person? Getting pretty pictures of scars to show at conferences and not taking many people back to theatre. As far as I was concerned, that was me doing a good quality surgical service. But the third factor of quality is the patient experience. And there's no money for improving it. You can't benchmark against others because patients are individual, but it's, I think, the thing that matters the most. And it's not just the patient experience in the hospital. It's when we say goodbye, when they're left to cope. And there are so many little things that anybody involved in healthcare can do just to make patients' lives better. And what I'm planning to do in my talk is just to give an overall view of things you can do to help. And it comes down to things like communication. The words you use, the phrases you say. Some people would, I used to tell patients it was lucky we caught their cancer early, because I've seen the really bad cancers. A lot of us have. But when you're a patient, no one is lucky to get cancer. No cancer is good to have. And until you've, again, heard those words, you can't realize what patients need to hear. We give them so much information, it goes in one ear and out the other. And it's little things we can all do just to help patients on their journey get back to living a decent quality of life again.